Hi everyone, this is Dr. Ansari. I'm going to be talking to you about non-surgical treatments for prolapse. So things that you can do to avoid surgery or delay surgery. So first of all, take a look at my anatomy video where I'm standing in a pink tunnel to try to understand where the surrounding organs to the vagina are located. This will help you understand a little bit more about how and where which organs are coming down. So first of all, you can do nothing for this problem if it's not bad, okay? If it's really not bothering you, not impacting you in any way, not stopping you from doing things that you love to do, then, and it's not uncomfortable or painful, then you can choose to do nothing because this is not harmful, okay? Alternatively, it may be a good idea if it's picked up early to start pelvic floor physical therapy, okay? Pelvic floor physical therapy is a good approach for someone where you have prolapse and maybe it's not bothering you, so maybe you can stop it from getting worse, okay? Or delay the worsening, I should say. Or let's say you have it, but it's very small, like a stage 1 or an early stage 2, and the maximum stage is 4, where everything is just hanging out completely. So if you're in the early part of the prolapse, stage 1 or early stage 2, then pelvic floor physical therapy might be a better approach because surgery is not going to be a good option for you. In order to have surgery, you have to have more prolapse for the surgeon to actually do something on it, right? There has to be more slack, let's say, for a surgeon to work on it. So if it's just not enough slack, there's just not enough of a droppage, then you probably are good to try pelvic floor PT. And for patients who have more advanced advanced prolapse, PT may be good to try to slow it down further from getting worse, and maybe even pull it up a couple centimeters. But it won't solve the problem if you have advanced prolapse, stage 3 or stage 4 prolapse, even some stage 2 prolapses. So in a separate video, we're going to talk about surgery for prolapse, so you can always take a look at that next. And now third is Pessary. A Pessary is a vaginal ring, and imagine that it's like a dam almost. Imagine that we're putting in this silicone device and it holds everything up where it belongs, all right? So if this is your vagina and let's say the uterus here, rather than being up here, okay, where it needs to be, let's say it's actually descending down and now is actually sticking out and hanging inside the vagina, okay? So now you can actually see or feel the cervix, the opening of the uterus. So what happens is that when we place the pessary, which is a ring, and it comes in different sizes, so I'm just going to make it look like a simple circle, but it may not be a simple circle. It may have like a funny knob or a stem to it, or a different shape to it. We put it in and we push this uterus back up. So now what happens is, now the uterus is going to be supported. Let me draw this out again. Supported. Once the pessary is in, it pushes it all up and it hangs out right here like this, okay? And it acts as a dam. It keeps the uterus up from falling back down, all right? This is a removable device, so it's fitted in the office. It sometimes takes a couple appointments to find the right size or shape, and it's removable by the doctor. And if it's a simple circle type of pessary, it could be removed by you, and you can manage it. Or if you really don't want to manage that, then you see the doctor every few months to have it removed, cleaned, check out the vagina, make sure it looks okay, and then the doctor puts it back in. So that's a pessary, and it's a good non-surgical approach to treating a prolapse, usually a prolapse of the uterus or of the bladder. Okay, uterus, bladder, and sometimes for the rectum as well. It's not always effective for the prolapse of the rectum or erectocele when it pops up into the vagina, but sometimes it can be useful. All right, so it's worth a try if you're trying to avoid surgery.